Okay, we were talking about EMG. So Anthony, his question was whether or not Brian had on his EMG findings of motor neuron disease. And that I know that that's been a question oftentimes of people that reversed, meaning was it really ALS to begin with? And so what you guys were just talking about was the first EMG, that whole, well, we don't know. So what was the finding on your first EMG?
Just wasn't totally sure. I said, well, come back in 6 months.
It was abnormal or it was within normal range?
No, he said looked like it was abnormal. He wasn't sure.
Okay.
And
come
didn't
back.
give me, it was inconclusive. That's what it was.
Inconclusive, come back in 6 months. All right, the two of you guys.
Right, and the first one that Linda had was fine. They didn't find anything wrong. But at that point, that's when her speech was really slurred. And the EMG didn't show anything. And it was, I can't remember how many months later, 8 months maybe, we went to see a different neurologist. And they also did an EMG. And his results were kind of inconclusive. He says, well, I see a little bit of slight nerve damage maybe in your left calf, maybe in your right thumb and your left shoulder, but it's kind of not really there. But so I'm not real sure. I don't really see anything that's like remarkable, like that sticks out. So that was kind of frustrating, because we've had this diagnosis of ALS and we're trying to get a second opinion, and crossed his arms and said, well, if I have to call it something, I'll call it ALS. So that was not reassuring whatsoever. Still at that point, we just had no idea what was going on.
So we were just talking before I turned the video back on. You guys were commiserating over what it's like when you first start this whole process. And Brian, you were saying the same thing, that they took a look and they're like, well, it's not conclusive. Come back in 6 months. And Linda and Anthony were shaking their heads like, yep, we know that process. And then you come back and still everybody's kind of like, well, and that was your point. Well, we still aren't quite sure what's going on.
You have every symptom. I was like, what?
Right, it is. It's you're the patient, so you're looking for an answer.
Oh, I was angry.
So angry. And you're not getting an answer. But they're giving you a diagnosis based on a test that you're passing. Basically, when they say your EMG testing is normal, then how am I getting this diagnosis? So,
well, again, the reason I turned the video on is not to capture the frustration of this whole thing, but I was telling you, Brian, I put the video up and somebody had already sent a response just to say, well, what did your EMG show? And so it's a common question again, how are people getting diagnosed? What does it look like when you have this disease? For everybody that's new, I think, newly diagnosed, they're asking those questions just to kind of get a sense of what it looks like. I always hear the same. The report that I get from everybody is exactly what the two of you just described, which is you go in the first time, and for most, not for everybody, but for a lot of people, the EMG is scheduled. There is traditionally an MRI just to rule out other potential problems, whether it's a bleed or a stroke, multiple sclerosis or scarring. And then what happens is the EMG, usually it's not definitive. So the explanation for everybody that's watching, I'll come back over to you guys, for everybody that's watching that's just navigating this for the first time, normally what it looks like is, well, your MRI is negative for findings. Your EMG doesn't really have any specific findings. Go home, come on back in about 6 months, and we'll see what's going on. And then 6 months later, of course, even more symptoms or deficits. And that's commonly, Anthony, to your point, where people are saying, we think that this is suspicious for motor neuron disease, or if upper and lower motor neurons are affected, we think that this is ALS. On your side, right, there may not be a conclusive EMG, and oftentimes there is not. There are no findings on an image. You know something's really wrong by this point because you're 6 months farther into symptoms than you were when you first were showing symptoms, and nobody is really positive, but ALS is already being discussed. And what we were talking about, and we did on the audio, but now just talking about it, once you are diagnosed, then Linda, to your point, the answer is, hey, eat whatever you want. And so you were discussing the fact that before you came over here, I mean, you were just eating a high sugar diet with the idea of, let me keep my weight on. So not only is there not a lot of information about what you actually have and no real tests that are definitive at that point, now you've got your diagnosis and you're just eating everything that you can find because you've been told ice cream or anything else, go ahead and eat it to keep your weight on.
That's right. Right. And we asked about even like other testing. Is there other testing that might show like Lyme or something like that? And we were told, no, that's got nothing to do with it.
Yes. Yeah.
Nothing to do with this.
Again, the reason that I'm videoing this, so for everybody that's going to watch it afterwards, and the question is, why would we video this conversation and put it out there? Because I think for a lot of people, especially when you're newly diagnosed or just going through this, the question is, what does the process look like, and have other people gone through a similar process? So really, just for the sake, I think, of insight and education for people that are new to these symptoms, what I find, everybody that has been diagnosed for any length of time, everybody knows this story because everybody's been through it. But again, for everybody that is just being diagnosed and hearing these things, and then commonly I'll get the question, is this normally what happens? The three of you could speak to it, of course, much better than I can. But yeah, this is normally the process. There isn't a definitive test that says, hey, you have ALS. Instead, testing is traditionally negative. What I would say, so just kind of using these videos on my side as an opportunity to put some information out there. Keep in mind, so let's have a conversation on imaging. So what did not happen for you, the three of you, right? But what we're asking be changed moving forward. So what everybody should know, MRIs, it's an imaging study. It can rule out certain things in the brain, but it can't definitively see changes in the brain that could represent ALS, because MRIs have a certain magnet strength. That magnet is represented by a unit of measurement referred to as Tesla. And so every MRI has a Tesla rating. Most general or common MRIs that you find are a 1.5 or 3 Tesla. Right? That's the magnet strength. What everybody needs to know is the strength of the magnet correlates to the clarity of the picture. So a couple of things. One, the width of the slice, right? If the slices are too wide, you can't see anything. And two, the strength of the magnet. In an ideal situation, you want thin slices and the highest magnet for the obvious reasons. Although the standard imaging is done at 1.5 or 5 Tesla, I'm sorry, not 5, 1.5 or 3 Tesla. 5 Teslas are common. 7 Teslas are harder to find, but they're around. And so we have already seen evidence of somebody that had ALS. They were diagnosed based on their MRI. So that is something that can be done. The difference is it was actually something that was in a clinical trial to have a 7 Tesla image. So the trial was not about medication. The trial was to see with higher Tesla resolution if they can get a better picture. And on a 7 Tesla, they diagnosed. And we, of course, have the image and the report. And so it's very clear, the findings over there. So going back to the conversation that we're having right now, which is the frustration of having symptoms, having an MRI, having nerve conduction and or an EMG, being told, we don't know what this is, come back in 6 months. And then you come back, symptoms have worsened, and that's how you get the diagnosis of ALS. For everybody that may be watching this, I know you've got something to say, for everybody that may be watching this that's new to this, please do know, for both of you, you had the diagnosis of ALS several years ago. Although 5 and 7 Teslas were available, I think there was less rationale as far as why to use them. But now, if you are going through this, please go back to your neurologist. It looks as simple as a prescription. Ideally, your initial MRI would be a higher resolution, especially if contrast is being used, because you do not want to subject yourself to contrast like gadolinium multiple times. Ideally, your first MRI would give the type of clarity to determine, we're not trying to figure out if it's ALS or not. Instead, it would be cause. And so to let everybody know, the MRI that showed and was diagnostic for ALS, it was iron deposition in a specific part of the brain, and radiology read it as a likely ALS. And so that's to say, even though that was the finding of that one MRI and that one individual, the reason we were talking earlier, in your case, Brian, for example, mold being a final trigger of a lot of other infections, and Linda, a number of different infections plus a perchlorate chemical, just know if we could actually see higher resolution, so a 5 or 7 Tesla MRI image, we could likely get clear on these infections. Different infections like different areas of the brain. Different infections look different on an MRI. And so, again, for anybody that's going through this now, please try and get, it's just a prescription. So the same prescription that you have that says MRI, this one would just say MRI 7 Tesla. Typically, MRIs are sliced at 5 millimeter. That looks to be adequate. Okay, tell me, Brian, what were you thinking?
No, nothing. My uncle passed away from ALS, and as soon as I was told I had it, I started researching, and I wanted to do something right away. I just jumped on it right away, that's all.
Mm-hmm. Just talking about MRIs, the reason I would like it to be done at the beginning, well, imagine, first of all, it might give a clear idea as to the cause.
Exactly.
Based on what's showing up and the location of the brain, but also we've had a number of folks that we had wanted them at this point to go for a higher resolution MRI, but they have been unable to. And the reason for an MRI, the higher the Tesla, commonly the smaller the tube. So for anybody that's already been in an MRI, you know, number one, you're laying down, and number two, there is a very small area because you're in that tube. The more advanced somebody becomes, or to say this differently, if it's somebody that has breathing difficulty, oftentimes you cannot get in that tube, right? If it's somebody that can't lay flat any longer, then chances are you can't get into that tube. A lot of the higher resolution Teslas, not all of them, but several of them, they have steps to get up to them just because of the magnet size and where the tube is. And so if you have motor neuron disease, and you don't have a high resolution and you want to get it, it would be our recommendation as a center to please try. If you can't, then that's fine. And so what that would look like, you would take your prescription, you would go to the MRI center, or they'd call you from the MRI center, you'd let them know what your restrictions are. For example, I need oxygen. Is there oxygen in the tube? I can lay down, but only in this kind of way. And then they would tell you. So it doesn't mean that you couldn't try. And getting a prescription for an MRI is incredibly easy. What is unclear is whether or not insurance would cover it. An MRI out of pocket, you're between about $2,000 and $10,000, depending on the magnet, the number of slices, and the number of planes being sliced. Okay, but that kind of gives you a sense of things. And certainly, because we started this conversation for people that are newly diagnosed or prior to diagnosis, just dealing with symptoms, rather than just getting an MRI that's a 1.5 or 3 Tesla, that's very definitely your time to say, hey, I want high resolution, even if it means, right, having the conversation of if there's something more that you've got to pay, perhaps doing that, or if you have to come out of pocket, trying to negotiate prices with imaging centers, because that picture, if it's high enough resolution, could be incredibly insightful.
Mm-hmm.
Yeah. And then as somebody that has recovered, Brian, imagine for your uncle, he was diagnosed and sick with ALS 15 years before your symptoms. So I agree, at that time, there were very few options in this disease. I'm just not in agreement that that's the case any longer. And for you, as somebody that's a recovery, right, we know that it's not true. And just going back to our previous conversation on our other video, we know already, you had already brought somebody up that you know that has reversed, but has not been recorded as a reversal, as a complete recovery. We know as well as a center, we have a number of those folks. So the question is, what does this disease look like? Well, the more we could know about it, the better we could get at finding solutions. Going back, Anthony, Linda, to the fact that you started out at the beginning, you had the MRI, it was not definitive. You had the EMG, it was unclear until finally over time it became abnormal. You'd already at that point had symptoms for an extended period of time. And so the question is, from an educational point of view, or things that we could do differently for people in the future, what could be done? We know if it's a 1.5 or 3 Tesla, we're not going to see anything, but this would be the call to action for anybody watching it to insist on a higher resolution so that conclusions could potentially be drawn about cause as early as possible.
Right. You have to be your own advocate, and you have to fight. A lot of times, just don't take them at their word of like this is the end or it's terminal. You know, you have to find that root causes, and fight back. You know, do some research, and you know, get a plan going forward. You know, because it's you can fight back and you can win.
Yeah,
it's possible.
My other call to action out there for anybody that's watching that wants to make a difference, one of the areas that is very definitely missing in the field of motor neuron is immunology, right? So immunology, the study of infections and how infections cause diseases. If immunology could provide some insights and work in concert with neurology and really add additional insights into some of these infections, it could be an enormous help. So going back to the idea of, can we get higher resolution MRIs? The answer is yes. Could we get more information and more support from immunology, right? A field that looks at infections and the role of those infections in disease, and the answer is yes. And then with that higher resolution MRI, we could match up certain infections to certain locations. That has already been done in other diseases. So as, again, a call to action and things for people that are watching that could, in my mind, really change what's happening in the world of motor neuron disease and treatments for it. Consider if you're a center, a multidisciplinary center that's treating ALS, partnering with immunology could be a revolutionary change for people in the future that have this disease.
That's right, and I would get a hold of your neurologist, and if you get this diagnosis, tell them you want, they're so limited on any of the standard testing that most everybody gets, but you need testing for all kinds of other infections, environmental exposures, and other chemical toxins and things. You need to request those type of testing, you know, and see if they can't get those ordered for you, you know, and so where you can at least get a starting point and see what's going on with your body.
I think
try
it's
to figure those things out.
Common request. I think oftentimes people just don't have access to those tests. And I don't know from a traditional standpoint that those tests would be offered, but I do like your idea, Anthony, and I do think people should be asking for it, just to give a list of the things that we think are a priority in the initial workup. Very definitely a pathogen panel. And that pathogen panel should include the things that we've talked about. So, you know, Linda, on your side, CMV and EBV, so getting clear on herpetics, both antibody and antigen. So we send antigen testing out to Germany. It's just the best lab we found. But to get comprehensive antigen plus antibody for viruses, especially herpetics, to look for other infections, toxoplasma, because it has an associated link, parvo-19 because there's an association with neuroinflammation, a full tick-borne panel, so not just Lyme, but all the co-infections. We'll look for the link of mycoplasma. It's a known predisposing risk factor as far as an infection for motor neuron disease. We'll look for things like Coxsackie. So we'll get a comprehensive pathogen panel, both antibody and then as well antigen. Brian, to the point that we made earlier, we run a comprehensive nutritional panel. We were talking in the earlier video about immune support. Certainly, we as a center are not going to go after infections if your immune system is not vigilant enough to do its part. And so we will do extensive immune testing, so specifically inflammatory cytokines, We will look through white cell and white cell distribution, including the complement system, helpers versus cytotoxic killers. We will, let me see what I'm missing over there. We'll do basic CBC and CMP. We'll do that kind of stuff. And we'll look at things like iron and ferritin, the basic kind of labs. But right now I'm kind of going past that. We'll look at gut health. So I'll come on over for you, Brian. And the reason is, we know already gut health was a big part of you and I suspect stabilizing things and even leading to your recovery. And on the gut health, we'll look at stool. If there's infections in the intestines, we'll look to address them. If there's food sensitivities, we'll look to modify a diet to eliminate things that are causing inflammation. And then we'll look for nutritional depletions and make sure that we've corrected them. So at the very least, we'll do that. We will always do, and I'll come back over, Anthony, to your point, we'll do environmental toxins. We'll break out things like pesticides. That's how, Linda, on your side, we saw perchlorates. So not just pesticides, but other chemicals as well. We will use heavy metal testing to gauge any replication of infections that's increasing. And we recently added an extensive perfluorate test. So we were already measuring perchlorates, so multiple chlorine compounds, usually on a ringed structure, not always. And then we've added to that to get a better understanding of halide toxicity. Remember, halides are in one line of the periodic table, so chlorine, fluorine, bromine types of things. So we've extended that to get better fluorination exposures, and we definitely have seen that link. I'm trying to think if there's anything else. Nothing comes to mind, but I know there's a handful of other things. And of course, it's really specific. If somebody comes in and they have a certain kind of exposure, we'll look for that. We will commonly run genetics, not the genetics of risk for motor neuron disease. That's usually done at neurology and covered by insurance. But we will run genetics for liver detoxification. So phase 1, phase 2, meaning cytochrome P450 pathways, as well as phase 2 to figure out, are you a poor detoxifier? Then we'll match up the chemical, its detoxification pathway. We will not detoxify if somebody has a limited detoxification pathway. So this is a warning for anybody that's out there that wants to use a detoxification protocol. You should know your detoxification pathways and any limitations over there so you don't repoison yourself. But I agree, Anthony, again, going to neurology and asking for these tests, or if you're unable to get them, going to other places, centers that are comprehensive and functional, meaning root cause analysis more being their focus. Those tests become important. I know that they are expensive. I would tell you still they're the number one investment, the best investment that you could make. And the earlier that you make that investment and get those tests, the better. What I would say as far as getting test results, make sure that somebody is actionable, meaning don't just get the results and then nothing gets done. So to the point that you made, Anthony, of being your own advocate, you press hard to make sure, hey, this is what's going on my lab. What are we going to do next? With that, my caution, don't just do stuff. Don't detoxify. Don't take a bunch of really harsh medications. Don't just go after infections. Wait for all of the labs so you can determine what type of immune health you have, what type of nutritional health. If somebody is suggesting, for example, an anti-pathogen strategy in the form of antibiotics, let's say for Lyme, and then Brian, in your case with a bad belly, and let's say that you've got infections in the gut or a lot of dysbiosis, you would look to clean that up first, because imagine otherwise you would take a bad belly situation and potentially make it a lot worse. And we brought on, after the study in June, on 2 cases of ALS that responded very impressively to fecal microbiota transplant. You may find that cleaning up a gut, even using things like fecal microbiota transplant, has to occur prior to a treatment if that treatment is going to be tough on the gut, right? Because we know if you cause inflammation in the gut, you're likely going to cause progression. Yeah, I think so too. All right, it's words of wisdom. I'm going to title this video something like, if you're just finding out that you have ALS, or if you're worried because you've got symptoms consistent with ALS. And remember, for everybody that's watching this video, we're making this video with 2 folks that are better. So whatever you imagine it's going to be, let me see if I can get the 2 of you guys in one shot.
I demanded not to have the Lyme test. I said, I'm never in the woods. You were like, yo, I said, no, don't do it. It costs money, don't do it. And you taught me into doing it, and here I had problems.
And then we treated it, and it led to a recovery, right? So imagine you just want a bunch of information at the beginning, again, actionable, and then you don't want to just start doing stuff. I know how scary it is to be watching progression. You still don't just want to do stuff for the sake of it. You need a strategy. You need to know where you're starting, and you need to have an immune system that can manage if you invite infections to come out, and you need gut health that's strong enough. Remember, your primary elimination or detoxification pathway is intestines, right? It's whatever your liver is going to detoxify and then put into the stool. If you've got belly issues or issues in your intestines and you start mobilizing toxins, get ready to get sick, right? And not get sick for a bigger purpose, like later on get better. This is just getting sick for the sake of getting sick. And yeah, I do remember that debate of why don't we test? You could see Brian's face. Again,
Bringing back a lot of memories.
Of everybody that we have that's a recovery, we have a lot of these stories of going through and what happened at the time and being in it. And yeah, I remember the same of you saying, I don't have tick-borne infection. And, on our side, we don't know if you do or you don't. What we do know is most people don't know the infections that they have. That's true for me as well. It's true for everybody. And so that first step
Never had the bullseye.
Yeah. So the first step, imagine on our side, and it's what we're suggesting for anybody that's watching this, that's going through it, do not just do stuff. Instead, just you're like shaking just get really strategic. See the entire picture, and then have a strategist that can put everything together and kind of phase it out for you into phase 1 is going to be this, phase 2 is going to be this. Make sure, again, you do not just launch something that could be devastating to an immune system if you do not have an immune system that is functioning properly. Make sure if you have a detoxification pathway that's not adequate. So again, colon that's inflamed, large intestines that's inflamed, and then you try and embark on a heavy metal detox, right? And then you've got metals trying to get through intestines, but they can't, and being repoisoned by those same metals. Do look for detoxification genetics. That way you know what you're good at removing, you know what you're bad at removing. We were talking on the earlier video about using glutathione. If the ability to activate glutathione is limited, then using glutathione is probably not going to be your best option, and so you'd instead opt for a different antioxidant. So really, again, getting that information up front so that your team knows what they're doing becomes super important. I know. So Brian, you and me, now it's hindsight, huh? It's the happiness and the pain of knowing what happened for you to recover from ALS and how difficult that time was, and all of the conversations like, hey, what if this is an infection that we can't see? So a video that goes to new people.
But remember the first day I came in, I was like, test everything. I just want to, you remember. I was
ultimately,
like, I want everything. I don't care about the money. I want everything. I want to get a handle on this.
Yeah, ultimately that's what we wound up doing.
But I wasn't hip on the Lyme, though. I was like, not Lyme.
That's not testing everything.
I know, but I was like, I didn't have Lyme.
That's cherry picking what you want to test.
It's true.
All right. Okay, I'm going to turn this video off. This is our third now. But I don't know that we're going to wind up with another one, but we'll see. All right.